Well, good afternoon and welcome to our webinar on this Wednesday, July 29th. And we want to extend a warm welcome to all of our guests as well as clients that have taken the time to join us. We have a great topic for you today and a wonderful guest who I'll have the privilege of introducing here in just a little bit. So as you can see, Medicare Made Simple is the topic that we will cover. My name is Tim McLaughlin. I have the privilege of leading Harvest Point. We are a faith-based financial planning firm based out of central Iowa. We have clients that extend all across the country, many of whom are joining us today, as well as I mentioned, first-time guests. So welcome, and we want to go through a little bit of a preview of our agenda for the webinar. So as we do with all of our events here in a moment, I'll introduce our charity partner. We'll have a market update, some things to share with you about what's going on in the financial markets and the economy right now. And then, as I mentioned, we will introduce and meet our guest speaker. So if you are familiar with the Arthritis Foundation of Iowa, that's an organization that we have supported here locally. And of course, they are important and do important work in our community. And we're grateful to partner with them and raise awareness for their organization. Like I mentioned, at each of our events, we choose a charity partner and we will make a donation to that organization on behalf of the attendees that we have. You're never asked to support, but we do want to partner with the organization in the efforts to raise awareness for the important work that they are doing. We will be sure to reserve time at the end of our webinar today for questions. So as you are listening, if you have questions that you've come up with, perhaps you came to the webinar today with questions, we would welcome those to be asked during our webinar today. And we usually reserve time at the end for that. So the best way to ask the question would be to email in to info@harvestpointwm.com. Our compliance folks have disabled the chat feature, so we do not have an ability to take questions that way, but we will gather questions from our email address. So be sure to send those in as we're going throughout the presentation today. Well, Harvest Point exists to wisely and faithfully guide our clients and equip them to wisely steward the wealth that has been entrusted to them. So it's our privilege to do that. We get to do that each day with our clients. I'm often asked, why Harvest Point? And there's several reasons. We don't have time to get into all those today. We sure would love to further the conversation with you down the road, but we're grateful for our 98% client retention ratio. Nearly 60% of the clients' households that we work with are multi-generational, sometimes 2-3 generations at once that we have the privilege to serve. And then one important point in today's day and age where we get frustrated, if you're like me, you call in somewhere and you try to get an answer and you get a robot. And you are unsuccessful, again, if you're like me, in getting in touch with the human and how aggravating that can be. So we try to be the antithesis of that. We want direct access for you when you call our office. Typically, it's Angela who answers, and she'd be glad to direct your call or help you up if she can with your request. Well, wanted to take a minute too to highlight our folks here at our firm, and we have 10 great individuals on the screen here, and 11th that we'll talk about here in just a second. But a special congratulations to Lucas. He and his now wife Dana were married here recently since our last webinar, so we wanted to congratulate them. And then coming up here in a couple of weeks, Lauren and her fiance Isaac will be getting married as well. So love is in the air at Harvest Point, apparently. Congratulations to those two. I also want to introduce and say thank you to our intern, Luke Callahan. Luke joined us from Iowa State University. I cannot believe that made it through the approval process. I must have been gone that day, but he has done a great job in all seriousness this summer helping us out. He's actually also running the controls in the background during today's webinar. So thank you, Luke, for all of your contributions. It's been great to have you on board this summer. Well, we also want to draw your attention to two QR codes. One on the left is our Discovery Questionnaire. So if what you're hearing today, it maybe involves additional questions that you might have or you'd like additional information, a great way to start and learn more about our firm is to fill out that Discovery Questionnaire, because what will happen after you do that is someone from our team will reach out in a timely fashion, and we will get a time scheduled on the calendar with an advisor to connect you with an advisor here at our firm. And we'd love to learn more about your particular individual financial situation to see how we might be able to help. Similarly, we have an opportunity with the QR code on the right to leave a review. And we're grateful for all of our clients that have taken the opportunity to do that and just share what their experience has been with our firm. And that has made a big difference for prospective clients as they come in and try to get a better understanding of what we're all about here at Harvest Point. Well, with that said, let's talk briefly about what's going on in the economy first, and then maybe a little bit on the financial markets, and then we'll introduce our guest speaker for our topic. So a little bit of a broken record here as it pertains to the U.S. economy. Things continue to look overall relatively strong. In fact, almost all components that make up the economy are still showing an expansionary territory right now, with the exception of job sentiment, which is in that recessionary category. So similar readings over previous months as we've kind of spread that out here on the screen, March of 2026 and also December of 2025. If anything, there's been a bit of an improvement in overall economic activity. Of course, we're waiting later today to see what the Federal Reserve does. And as always, we're monitoring the overseas conflict that has been going on for quite some time. And all of those things obviously play into the direction of the economy and the financial markets as a whole. But first half of 2026 was pretty darn good. In fact, we, as you might already know, we are now in the fourth year of a bull market, and we've gone up by over 100%, actually 101.5% since October 12th of 2022. All of the information on this particular screen is as of the middle of June, so a month and a half or so ago. But nevertheless, the story remains true. And that is oftentimes when we get into longer bull markets and bull markets that produce gains of over 100%, the average of those bull markets tends to be closer to 260%, which would tell us that there is at least a chance that we could continue going forward and up in this particular bull market and possibly even make it to year 5. So we're watching that. I think some headwinds that we have, as we all well know, this is a midterm election year. And historically, in midterm election years, we have larger than normal intra-year declines to the tune of about 17.5%. And we haven't seen that quite yet here in 2026. So that's something we're watching, especially because those declines tend to occur later in the calendar year. Now, if there's a silver lining, it is that over the subsequent year after those declines, a year after those lows, we do have sizable recoveries, as is displayed there, over a 31% recovery. So even if we do have those declines, there's some strong data that would support a quicker recovery after that. But that's what we're watching. Politics obviously is in the news. And the next chart here goes all the way back to 1901. And regardless of Republican or Democrat, what stands out to me is the slow increase over the majority of the chart. Over 120 years displayed there. Obviously, yes, there's pockets in there with declines, but we tend to sometimes allow the political side to provide us an opportunity to worry about what's going to happen next in the financial markets. But as we have studied here internally, a lot of times there is not too much of a relation between the political side and the financial markets. The financial markets are so keen and honed in on corporate earnings, which have been quite strong recently, and the consumer and the condition of the consumer. And so it's just a good reminder, I think, as we're getting closer to those midterm elections, to kind of see through a lot of the noise that tends to be out there. And final note on politics is, if there was really any trend that we have seen, it's that the markets like a split Congress. So depending on what happens here in midterm elections, on average, when we have a split Congress, the market has returned about 17% on the S&P 500, going all the way back to 1982. It's a pretty compelling data there, and some strong recent examples too, just in the past 7 years. So that's another interesting thing to keep our eye on as we go forward here in 2026. Well, before I turn it over to our guest speaker, it's always just a good, important reminder, as we often say here at Harvest Point, that client is the most important person in our company. And we want to say thank you to all of our clients for trusting us with the important responsibility of helping you prepare for the future and steward the resources that you have. We love doing that. It's our life's work. And it's my privilege to come to work every day with those folks that I showed you earlier on the screen and work hard for you. Well, let me introduce our guest speaker. Colin Miller is the CEO and lead consultant with his firm, Medicare Plan Partners. And after spending years in the insurance and financial planning industry, Colin recognized a common frustration: the Medicare enrollment process lacked personalization, unbiased guidance, and he decided to step in, and he saw that gap, and he wanted to have a truly client-focused advisory service. And so that's why he built the firm on the belief that clear, trustworthy Medicare advice is essential to every individual's health and financial well-being. So Colin lives in the suburbs of Philadelphia, Pennsylvania, with his wife, Jules. And outside of work, he enjoys summer weekends in Ocean City, New Jersey, exploring new restaurants and spending time with his family. He's an avid musician and golfer, both. Impressive. A man of many talents. So Colin, I will turn it over to you. I've never been to New Jersey, so if I ever come out east, I have a friend. And I would be remiss if I also didn't mention, yes, Colin Miller works at Harvest Point, just not this Colin Miller. So we're going to have to start referring to this Colin Miller as our Medicare Colin Miller, and then we've got Harvest Point Colin Miller. So we don't aim to confuse. It just so happened that two great individuals with the same name, just a slight spelling differential. So welcome, Colin, and I'll turn it over to you.
Thank you, Tim. And thanks to the Harvest Point team. You guys have really done a great job with this in preparation, and I can really tell how much you care about your clients. So I really appreciate the opportunity, and yes, send those questions in via email if you have questions. We have a lot to cover. Medicare is very confusing, and I meet with a lot of anxious people turning 65. So hopefully today we can clarify some of the Medicare myths around enrollment and when you should be enrolling in Medicare versus when you really shouldn't be enrolling in Medicare. We'll also discuss Medicare Advantage and how that differs from the traditional or original Medicare package. We'll talk about income and how your income really does play a role in your overall healthcare costs in retirement. So without further ado, we want to keep this educational. I will tell you a little bit about myself. So I started my career in the financial services industry, big insurance company I worked at for about 3 years right after college. And like Tim said, I had a lot of people coming to me asking about Medicare because they couldn't find any real information, any straightforward guidance. So about 11 years ago, I started Medicare Plan Partners. I left the company that I was at, and we have a great team. We have a team of 5 people in our office. So we want to make sure that we support our clients just in the way that Harvest Point does. Medicare enrollment. When should you be enrolling in Medicare? When are you eligible for Medicare? Well, it's fairly simple, but it gets complicated all the time with talking to friends or family members or reading something online. So when you're turning 65, you become eligible for Medicare the first day of the month that you turn 65, assuming you or your spouse has paid taxes for 10 years in the States. So yes, you're eligible to go on Medicare the first day of the month that you turn 65. If you're turning 65 August 15th, you can be on Medicare August 1st. And if you don't have coverage through an employer, if you have coverage through a small company, maybe you're a small business owner, but if you don't have coverage through an employer with over 20 employees, that's a really important rule. 20 employees or more, you can delay Medicare. But if you have coverage through the marketplace, or if you work for a small business or you own a small business with under 20 employees, you have to enroll in Medicare, and you really want to have that coverage in place the first day of the month that you turn 65. You can start signing up for Medicare 3 months prior to that. So the first day of the month that you're 65, you have 90 days prior to that to start signing up for the various parts of Medicare. And we always recommend doing it early because you want to have your cards in hand. You don't want to be going into Medicare rushing and worried about not having cards or not being enrolled. So we always recommend start that process 3 months before the month that you turn 65. And again, if you have a plan through the marketplace, or if you're on a small group plan, if you work for a company under 20 employees, you really want to make sure you're enrolling in your full Medicare package before you're turning 65. Now, a lot of people panic and they enroll in Medicare fully when they don't have to. So if you're going to still work when you're turning 65, or your spouse works and you have coverage through an employer that has 20 or more employees, you can delay Medicare. Believe it or not, you can delay all parts of Medicare, even Medicare Part A. I have people all the time say, my friend told me if I don't do something when I turn 65, I'm going to be penalized for the rest of my life. Again, as long as you have coverage, health insurance coverage through an employer with 20 or more employees, you will not be penalized for not signing up for Medicare right when you turn 65. You can do that later when you're approaching retirement, or maybe your spouse is approaching retirement, and you'll be losing that employer-based health insurance plan. So if you're covered and you like your coverage at work and it's a group that has over 20 employees and that coverage is working well for you, by all means, stay on your employer coverage. Don't enroll in Medicare. But most times, what I would recommend is, even if you're going to do that, even if you're delaying Medicare and you're not really going on Medicare because you have employer coverage, take Medicare Part A. Medicare Part A is free. It's not going to affect your employer coverage, but it will really act as a placeholder. By taking Medicare Part A, you'll be in the Medicare system. You'll get a red, white, and blue Medicare card. It would just make it a little bit easier for you to enroll in the rest of your Medicare package as you're approaching retirement. So turning 65, and if you don't have coverage through an employer, or you have coverage but it's a small employer, an employer under 20 employees, you can delay Medicare. You don't have to enroll right when you're 65, and that's typically what I would recommend doing. But just take Part A. Use that Part A as like a placeholder. Now, there's one more caveat, and it's an important caveat. If you're contributing to a health savings account, so you're working, you're turning 65, your company's over 20 employees, and you contribute to a health savings account, you're actually not even allowed to enroll in Medicare Part A, because that would mean you're violating a tax code by continuing those contributions to the HSA. So I love health savings accounts. I think they're great savings vehicles. You can use your health savings account in retirement to help pay for Medicare premiums. And if that's you, if you're contributing to a health savings account and you like your coverage at work and there's over 20 employees, keep those contributions going. Let your 65th birthday come and go. Do not enroll in any parts of Medicare. And we can get you on Medicare later down the road as you're approaching retirement. There's no timeline that you will have other than retiring and losing coverage as your trigger point to then go on Medicare. So I hope that helped with some of the enrollment timing discussions and maybe some questions that anyone here is turning 65 has about when should I enroll in Medicare versus when I shouldn't enroll in Medicare. Now, the reason I would not recommend you enroll in Medicare Part B if you're still working and you have employer coverage is because the government is going to charge you a monthly premium to have Medicare Part B. Medicare Part A is free. And let's take a few moments to go through that. So as we discuss here, it becomes a little bit more clear. So Medicare Part A, this is the government Medicare program. It's the federal coverage for inpatient hospitalization and short-term skilled care. So Part A of Medicare is free. The government doesn't charge you to have Medicare Part A. And all it covers is inpatient hospital, your hospital bed and the jello the nurses bring you, and some skilled care services like skilled nursing care, hospice care, or at-home care up to 100 days. So Medicare Part A is very basic. It's free. You don't pay a premium to the government to have it, which is why if you're turning 65 and you're not contributing to an HSA, you still have your coverage at work, just enroll in Part A. Because again, it will act as a placeholder for you. You'll have a Medicare number, you'll be in the Medicare system. It will then be easier for you to enroll in the rest of your Medicare package as you approach retirement. Now, having Medicare Part A while you're still working and have coverage under an employer plan, it just acts as backup coverage. So if you're hospitalized, you can still give your doctors your red, white, and blue Medicare card, and Part A of Medicare would potentially cover some hospitalization costs that your employer-based plan would not cover. Medicare Part B, this is the main medical coverage on Medicare. So the government offers you Medicare A for free, and then Medicare Part B, you pay a premium to the government to have. Medicare Part B is what covers your primary care visits, preventative care services, specialists, surgeries, lab work, durable medical equipment, physical therapy, MRIs, X-rays, CAT scans, infusions, injections, chemotherapy. So Medicare Part B is essentially covering all the medical services that aren't under Part A, which is just your inpatient hospital stay and skilled care. Medicare Part B is your much more regularly used medical care, but also it covers you for the major surgeries, things like chemotherapy, infusions. It covers the large items as well. Now, if you're still working and you have coverage through, a company with over 20 employees, delay Medicare Part B. But if you're turning 65 and you're not working or you have coverage through a small company, enroll in Medicare Part B as you're leading up to your 65th birthday, 3 months prior to that. But while you're still working, if you have that coverage through your company or your spouse's company, don't take Medicare Part B when you're turning 65 because you're going to start paying a premium to the government, a monthly fee to the government to have Medicare Part B when you're not going to be using it because you have your employer coverage in place. So at the time of retirement or turning 65, that's when you activate Medicare Part B. And you're activating that if you're, over 65 and now you're approaching retirement, you want to pick up Medicare Part B. Or if you're turning 65 and you don't have employer coverage or you have coverage through a small group, activate Part B right when you're turning 65 in those scenarios. So Medicare Part B, again, that's your main medical coverage on Medicare. And that is a a part of Medicare where the government does charge you a monthly premium to have. So I'm going to skip ahead a little bit before we talk about Medicare versus Medicare Advantage. But I want to talk a little bit about how your income really does affect your Medicare premiums. So what happens is when you enroll in Medicare Part B, whether that's at age 65 or you've delayed Medicare Part B and now you're retiring and starting Medicare Part B, at some point in the future, the government is going to actually look at your income. The government, the Social Security Administration, will contact the IRS and they will look at your adjusted gross income from 2 years prior. So if you're someone that's retiring this year and going on Medicare, or you're turning 65 and going on Medicare this year, the government is looking backwards. They're actually looking at your 2024 adjusted gross income. And as you can see here, I'm just going to jump to filing taxes jointly, but there you can see the individual filer rate. And then if you're filing joint with your husband or wife, you would look at this middle column here. But what you can see here is if your income 2 years ago was below 218,000 as a couple filing jointly, the government's going to charge you the base Medicare rate. It's $202.90 per month. But if your income exceeded 218,000 2 years prior, the government is going to want to add on what are called IRMA charges, IRMAA. It's the worst topic of conversation every year at Thanksgiving with my aunts and uncles and parents. We all talk about IRMA. So IRMA is an added charge that the government will add to your Medicare premium based on a higher income. And so you can see here the premiums can be as low as 202.90 per person with income under 218,000, but they can also be significantly higher depending on where your income falls. They can be the premium can be as high as 689.90 a month. Now, that's for someone making a couple making 750,000 or more. But again, you can see there's these income thresholds where the government will charge you for your Medicare premium based on income from 2 years ago. So again, this year in 2026, the government is using 2024, your tax return from 2024, to set your Medicare premiums. Now, there's a big caveat to this. The government does let you appeal these charges because I want to give an example to you. Let's say that you're 67 years old, you've been working, you haven't enrolled in Medicare yet because you didn't need to, you've had your employer coverage. And up until this point, you've been earning $300,000 between you and your spouse as a couple. The government is going to want to bring your premium from $202.90 a month that you pay the government all the way up to $405.80 per month. That's per person. So in that example, if your income used to be $300,000, the government is instead going to charge you $405.80 to have Medicare rather than that $202.90. But like I said, now you're retiring. And yeah, 2 years ago, your income was really high because you've still been working and you've had high income. And now in retirement, your income is going to be 200,000. Well, you can appeal that. You can let the government know, look, you're using income that's outdated from 2 years ago. I'm now retiring. I don't have that same income that I had 2 years ago. And you can actually appeal to the Social Security office to use your projected income in retirement. And that's where Tim and the team at Harvest Point can really help with actually projecting your income out in retirement so that we can file these appeals. Tim, is any questions coming in that you want me to address now, or do you just want me to keep going?
Yeah, actually, I did. It's funny you ask right now. How often do you see? It's more of actually a question I had. We've got some others here too, but because you just mentioned it, I wanted to filter it in. When people do appeal, because we've had clients do that, they filled out the necessary form. How often do you see that successful, that appeal be granted?
Well, I see it successful the overwhelming majority of the time. But, you have to know how to appeal and why you're appealing. If you just are in retirement and you take a big distribution from a 401k, that's counting as income, and the government will see that 2 years later. You can't appeal that. They're just going to say you're already retired. We don't care that you took a big distribution from your 401k or had a big capital gain. It just is what it is. But you can appeal based on a life-changing event, and that life-changing event more often than not is retirement. So if your income is truly reducing due to retirement, that is a perfectly legitimate appeal, and it should be approved. There should be no reason why that wouldn't be approved. Some other legitimate reasons you can appeal this is, let's say, you have, maybe your spouse passed away, and maybe your spouse was the breadwinner, and so there 2 years ago your income was much higher because you still had your spouse's income, but your spouse passed away. Now your income is much lower. You can appeal for a reason like that too. If you go from full-time work to part-time work, you can appeal. And if your income is truly lowering. So I think that the appeals should always get approved if they're legitimate and clients know why they're appealing. But people sometimes don't know why they can appeal or when they can appeal. So if you just do like a Roth conversion and you're already retired, that's going to spike your income. You can't really appeal that. It has to be pointed to a year that you retired or had a death of a spouse or your work reduction or something like that.
Makes sense. Okay,
Yep.
we have one more that's similar to the topic at hand with income thresholds. Bill from Missouri was asking, does my current income level affect how much I will have to pay for Part D?
Yeah, because there are also IRMA charges on Part D. So just like the government adds premiums to Medicare Part B, they will add it for prescription coverage as well. Medicare Part D, for anyone that doesn't know, that's your drug coverage under Medicare. And yes, IRMA charges will apply there too, based on your income. So here are the IRMA, those extra charges the government will charge you correlating with those same income thresholds. And you can see again, the government can really get you here on these Medicare premiums if you're a high income earner. So if you can appeal, we always recommend that you do. Great question. So let's talk a little bit. We've talked about enrollment and when to enroll, and we've talked about IRMA charges and what the government charges you just to have Medicare. I just want to reiterate, you don't need to take Medicare if you're still working and have employer coverage. There's no reason you should be paying that Medicare Part B premium or any IRMA charges if you are still working, you like that coverage, or your spouse is working and there's over 20 employees. So let's talk a little bit about original Medicare with a Medicare supplement plan and a prescription plan versus Medicare Advantage, and try to make some sense of what these two directions that you have are. So, original Medicare, that's Medicare A and B through the government. It's the federal Medicare program. And so, if you take original Medicare, the government is actually paying your claims. You're going to the doctors, you're giving your doctors your red, white, and blue government Medicare card. And the government is actually the first payer. They're the first line of your coverage. And what happens is under original Medicare through the government will pay the first 80% of your claims. So if you, let's say you're like my dad. My dad has now had 2 ankle replacements on Medicare. Very tough surgeries, very expensive surgeries, physical therapy thereafter. But he had original Medicare from the government. So that means when he got that surgery, let's just say it was a $100,000 surgery. The government paid 80,000 of that. They always pay a flat 80% of whatever your claims are. So that means there was a $20,000 open-ended gap for those two surgeries. To cover that 20% gap, if you take original Medicare, you would add on what's called a Medicare supplement plan. These are also known as Medigap plans. So Medicare supplement plans, you may have heard of like Plan F, Plan G, Plan N. These are standardized plans that follow Medicare so that when you go to a doctor and your doctor bills Medicare and the government pays 80% of your claim, you now have that 20% gap covered through your Medicare supplement plan. Now, that means you're paying the government for Medicare Part B, and you're paying a premium for your Medicare supplement plan. You have to go out and buy that coverage, buy that gap coverage. But if you're going with the original or traditional Medicare package, you absolutely want to have that gap plan in place, again, right when you're starting Medicare. So the supplemental plans, these are not plans that like overtake Medicare or add services. Like, a supplemental plan isn't going to add massage therapy to your medical plan. They're paying secondary to Medicare. So once Medicare has paid 80% of your claim, the supplemental plan kicks in to cover that 20% gap. The supplemental plan will also cover any hospital deductibles or daily copays. So these supplemental plans, these gap plans, as they're also called, what they're designed to do is keep your out-of-pocket exposure, your out-of-pocket medical bills extremely limited. Because when the government pays 80%, now you have that plan covering that 20% gap. One thing that's really important about Medicare supplement plans is they truly are all the same, regardless of what insurance carrier you use for your supplemental plan. So when the government came up with Medicare and said, all right, we're going to cover 80%, they also came up with the supplemental plans and exactly what they have to cover. So whether you have a supplemental plan through AARP or through Humana or through Cigna or Aetna, the coverage itself truly is all the same. The carrier you choose does not affect your coverage whatsoever, other than different companies will charge different premiums for the same exact supplemental plan. So you really want to shop. You want to look at who's offering competitive pricing for these supplemental plans. And then also look at, of course, A-rated carriers, strong financially rated carriers to choose a supplemental plan with. I'll talk a little bit more about supplemental plans and why it's so important if you want that to pick it up right when you're first starting Medicare. But let's skip over to the prescription drug plan. This is the last piece of what's called original Medicare. So the government itself, under Medicare A and B, does not cover prescriptions. Part D is a separate line item for prescription drug coverage. And so when you're going on Medicare and you're enrolling in Medicare A and B and you're choosing your supplemental plan, you can't stop there. You still have to add on your Part D prescription drug plan. And there's about 12 to 15 drug plans you can choose from. They all cover medications a little bit differently. So the best practice here when you're looking at prescription plans is not to go with the highest cost plan or the lowest cost plan. What you really need to do is look at how does each plan cover my specific list of medications. I'll give you another family example. My dad, when he first went on Medicare, was on like a statin, a blood pressure. He was paying $0 for his prescriptions. He was on a really inexpensive plan too, because they worked for his meds at the time. Then he had a bout of AFib. And because of AFib, they put him on Eliquis. Eliquis is a name brand medication. much more expensive than his statin and his blood pressure med. And all of a sudden, he goes from paying $0 for medications. Now he's paying about $1,200 a year for Eliquis. So going back to that, two things that really affect your Medicare, your overall healthcare costs in retirement. Income is number one, as we saw with your government premiums, and your prescription drug usage. My mom pays zero for medications. She's still on like very inexpensive medications, but I do see some people paying $2,000 a year for certain medications. You really want to get granular here when you're picking your drug plan to make sure it's a good fit for your specific medications, not just looking at the lowest premium or the highest premium. Now, all of that I just described is called Original Medicare. The government is your first and primary payer through Part A and Part B. You add on your Medicare supplement plan to cover that 20% gap, and then you add on a prescription plan. I do typically recommend that direction more than Medicare Advantage, which we'll get to momentarily. But the reason I recommend Original Medicare is it has open access to providers throughout the country. You're not every doctor has to accept Medicare, but it's about 97% of doctors do. So it would be very rare that you show up to a doctor and they say, hey, you have the wrong insurance. We don't accept it. Original Medicare gives you open access to providers throughout the country. For example, my dad they're lucky enough, they spend half the year now in Florida. They don't have to worry about whether they're in Pennsylvania or Florida because they're on Original Medicare. Their coverage just goes with them throughout the country. If they get a diagnosis, and they want to go to Sloan Kettering in New York, they can just go. There's not going to be network restrictions on that Original Medicare side. But you're paying an additional premium to have the supplemental plan and the prescription plan. But very predictable with Original Medicare. Your doctors don't have to fight with insurance companies to get your medical services approved. You're not going to get like the claims denials, and it really is straightforward coverage, and it's very good long-term protection against large out-of-pocket healthcare expenses. Medicare Advantage. This is what gets advertised heavily. You see Joe Namath talking about it on TV. You get tons of marketing for it. So Medicare Advantage is a replacement version of Medicare. Medicare Advantage is in the 90s and early 2000s, insurance companies said to the government, look, why don't you let us offer our own version of Medicare? That way, you don't have to worry about paying claims for a lot of people. We'll handle it. United Healthcare will handle it. Blue Cross will do it, or Humana, whoever it may be. And so those insurance companies are getting taxpayer funding to take people off the traditional Original Medicare program and put you onto a privatized version of Medicare, a managed care Medicare plan. And so that means your claims are no longer running through the federal Medicare program. They're not running through Medicare A and B. With Medicare Advantage, all of your coverage is getting run now through one insurance company. And you would be able to choose that company. It could be United Healthcare. It could be Humana. It could be Blue Cross. It could be Aetna. There's many different companies who offer these replacement versions of Medicare. And they're heavily, heavily advertised, and a lot of brokers kind of push people to these plans for higher commissions. But you really have to be weary of these plans before enrolling in them, because they do have network restrictions. If you go with the Medicare Advantage plan, you lose that open access to providers that you would have had with Original Medicare. So Medicare Advantage plans and the insurance company that you choose is going to have their networks of doctors that you can go to, and then doctors that are out of network that you can't go to. So much more limited in terms of your access to providers. Medicare Advantage plans, because you're now dealing directly with an insurance company who's managing your care, Um, the insurance company is going to require your doctors to submit prior authorization quests or requests. The data shows like 20% of claims just get denied off the bat on Medicare Advantage because, again, these are private for-profit plans and they're trying to maximize their profits by limiting care. So we do offer Medicare Advantage. I'm not a huge fan of it because, again, you can lose your doctors, you can have claims denied, and there can be very, very large out-of-pocket medical bills, unlike your original Medicare package. But we do offer both versions. Now, one really, really important thing to understand is that if you go to Medicare Advantage, and then, 2 years later, you decide, I made a mistake. I can't see doctors in network. My claims are getting denied. I'm getting $10,000 in medical bills. I want to go back to original Medicare and get the supplemental plan. Well, at that point, you may not be able to do so because pre-existing conditions would apply. So if you want to go back to original Medicare and get that supplemental plan, you could actually be permanently declined based on your health, based on pre-existing conditions. So if you've thought this through and you really want that original Medicare and your supplemental plan, don't like roll the dice. Don't go to an Advantage plan for a year and then think you can just go back to original Medicare, no questions asked. It could be impossible or very, very difficult. So if you're making that decision to go to a Medicare Advantage plan, truly understand what it is. Understand it's a replacement to Medicare. You're not on that federal Medicare program anymore. Now, there has to be a reason people take Medicare Advantage. One reason is Medicare Advantage plans are a lot of times $0. So where on original Medicare, you're paying for the supplemental plan and you're paying for the prescription plan. With Medicare Advantage, they're getting so much taxpayer funding that they don't even need to charge you a premium to have it. So you could essentially just pay your Medicare premium, your government Part B premium that we went through earlier, and then opt out and go to an all-in-one Medicare Advantage plan. I don't typically recommend it. I've unfortunately seen too many people like lose their doctors and then not be able to get out of it. Any healthcare provider, any doctor I've ever worked with says, I don't want to go with Medicare Advantage. So it does give me a lot of conviction in that original Medicare side is safer. And I've just seen it throughout the years of doing this. But Medicare Advantage can be a viable path for some people. And, it would be just, you want to make sure you're talking through it. You don't want to just make a blind decision because someone's selling you an Advantage plan or the advertisements look really good. Tim, anything I can clarify there? And we can, I'm almost ready to wrap up here. Unless there's anything that you think I would, you'd like me to go over.
Yeah, maybe we had one. Terry from Iowa writes in, says, I'm turning 65 soon, but planning to work a couple more years and keep contributing to my HSA. Heard there's strict rules about Medicare and HSAs. When must I stop contributing to avoid any penalties? What's the best way to spend down my HSA? I know you touched on that with HSAs earlier, so maybe just to reiterate.
Absolutely. Yeah, great question. So you're turning 65, you're still working. As long as Carrie, your employer has 20 or more employees, let your 65th birthday come and go. Do not enroll in Medicare Part A. Don't enroll in Medicare Part B. Keep stocking away money into that HSA account. Um, and then you can enroll in Medicare A and B as you're approaching retirement. So you can absolutely do that. Your question was good though, because you should stop contributions to your HSA 6 months before retirement. And the reason you should be doing that is because let's say that, again, you're going to retire next month and you're going on Medicare A and B September 1st. You're retiring now, you're going on Medicare. Well, when you enroll in A and B, the government is actually going to backdate your Part A 6 months from September. So technically speaking, there would be 6 months where you had been contributing to the HSA in violation of an IRS tax code. And so there would be 6 months of contributions to your HSA where you shouldn't have. So if you stop contributing to the HSA 6 months before retiring and enrolling in Medicare, that's best practice. What I will tell you is I've never seen anyone ever get dinged on that by the IRS. I've seen many, many people inadvertently contribute to their HSA while they had Medicare Part A, and usually your accountant can like either reverse that the next year when you do taxes. You're not going to be locked up or thrown in jail for, contributing to an HSA while you had Medicare Part A. It all can be reversed, and it will most likely it'll fly, you'd fly under the radar anyway. But best practice would be stop contributions 6 months prior to retirement.
Really
Any questions?
helpful.
Okay.
Yeah, and the other, I was going to share a statistic I came across recently from Fidelity. An average 65-year-old retiring in 2026 can expect to spend $185,500 on healthcare and medical expenses throughout retirement. So really, there's not going to be any shortage of medical expenses to spend down that HSA on, but you just have to be cognizant of the time frames.
Yeah, and that was actually part two of the question that I kind of forgot. Great point of like how should you be using your HSA, what's left over in your funds after after you retire and you're on Medicare. I always recommend keep growing that HSA, keep investing it. And I even recommend don't even use it for medical expenses if you can while you're still working. Just pay out of pocket for your deductible if you can, if your cash flow allows it. Pay out of pocket for your deductibles and your co-pays. Don't use your HSA. Keep stockpiling money in it. Keep investing in it. It will compound and grow, and that way, when you retire and you go on Medicare, you can start using what's left over in your HSA to pay these government Medicare premiums. So the 202.90 a month or more, you can just have that directly paid out of your HSA. Even if you're taking Social Security income, and I probably should have touched on that. So if you're someone who's going on Medicare and taking Social Security income, that premium gets deducted right out of your Social Security check every month. But you can still reimburse yourself using the HSA. So, I've had clients come to me, they're retiring, they have 50, 100, I've seen 200,000 in an HSA, and they're thinking, what the heck am I going to use all this money for in retirement? Well, you're going to use it for your Medicare Part B premiums. You're going to use it for your prescription drug copays. You're going to use it for your Medicare deductible, which is too low. It's $283, but you're going to get use out of your HSA in retirement when on Medicare.
Yep, I couldn't agree more. And okay, here's another quick one, and then I've got one final question for you. So oftentimes I'll hear from folks calling, "Oh, I don't need long-term care insurance because Medicare Part A, I have that. It's got me covered."
Yep. Well, of course, it lasts 100 days. Well, maybe not, of course. Medicare Part A for skilled care, you have a 100-day benefit period. So if you need skilled nursing or at-home care, you're only going to have 100 days under Medicare for those services to be covered by Medicare. At that point, after that, it converts. You're paying cash, or you have a long-term care policy, or some other long-term care strategy to pay those costs for long-term care. And above and beyond that, it's not that easy. Most things under Medicare are pretty easy. Getting skilled care covered under Medicare is not as easy as it might seem. You have to be hospitalized for 3 days prior for the government to cover skilled nursing care or at-home care.
Uh,
So there are requirements, and it wouldn't you never would want to have your long-term care plan be, I have Medicare, because it is not long-term care coverage.
Very helpful. Well, I think it's safe to say whether it's income or your medical background, your health history, what's going on currently with even prescriptions that you're taking, the Medicare decision is a very individualized decision. It varies person to person. And therefore, I think that's why great firms like yours, Colin, really can add value as clients evaluate their individual decision. It would be impossible for us to sit here and say which way someone should go without knowing a lot more details about their individual situation. So folks wanted to get in contact with you to maybe further the conversation. What's the easiest way to do that?
Email. Email is great. You call our office. I can either provide that to you now. So my office line, if anyone wants to take it down, is 215-315-7791. I'm at extension 1. I would recommend choosing extension 3 or 4 to get to Savannah or Ryan in my office, and they will help you get scheduled for a Medicare consultation. And shoot me an email. So my email is Colin, Colin, 1L, at MedicarePlanPartners.com. If you can shoot me an email, and we can work all throughout the country. And I know that everyone here is on Zoom, so you're comfortable with Zoom, and that's what we use too. Um, you know, just to recap, I think if you get anything out of this conversation, is what Tim said. It's all very nuanced. Each situation is different. I have people all the time say, "Well, what am I going to pay for Medicare?" And my answer to them, if I'm at a, family party, is I have no idea, because I don't know what your income is. I don't know what your prescriptions are. And there's a lot of things that really do go into your overall Medicare planning. So what I would leave you with is, if you're approaching age 65, talk to someone who is well versed in Medicare. It could be me, it could be your maybe you have a friend that does something similar to what I do. Talk to someone. Don't just go into this blindly and read forums online or talk to your friends, because there's going to be confusing situations and you might make a mistake. And then as you're approaching retirement, talk to someone. Don't just think I can figure all this all out myself and I can just get the plan of the month and then change things around next year. These rules are really complex. And we don't want to have any scenarios where, you're thinking you're doing something right, and all of a sudden it creates a big problem for you down the road. So whether that's my team, myself and my team, or anyone else that is really well versed in Medicare, a professional in this space, talk to someone. There's guidance out there to help you through this.
Well said, Colin, and thank you so much for all of your insights and wisdom today. It was a great, informative presentation. So just with regard to a few closing items, one thing that you will receive as an attendee of the webinar today is our Medicare enrollment checklist, which is a printable checklist that we'll get to you after the call in the days to come here, as well as a replay of the webinar. So if you want to go back and reference any of the information, if you're like me and you got to kind of hit pause sometimes and look at the figures and do some adding up, then we will make that available for you. Also, if you want to save the date for September 10th, where our next webinar is going to be about aging in place, a guide to housing and care choices. So somewhat similar to our conversation, Medicare and retirement, healthcare and retirement, but also how does housing come into play and what are the options in that regard. So September 10th at noon, we'll be excited to bring that to you. So finally, if you would be willing after the webinar today to take the brief survey that you'll receive, we use that information, your responses, to help inform the webinar topics that we do in the future. So we'd be grateful for your feedback about our webinar today. So thank you so much for taking the time to join us. For those of you who are clients, thank you for your continued business and the trust that you've placed in us. And then for prospective clients, new guests on the call, thank you for taking a minute to join us as well. We'd love to connect with you after the call, so please feel free to reach out and keep an eye out for our follow-up email with the replay as well as the checklist. It's a privilege to serve you, and have a wonderful rest of your Wednesday.